Our next speaker is Mary Bartram from the Mental Health Commission of Canada, where she is the policy director. Dr. Bartram has sent a pre-recorded presentation, so we'll be putting that up now, but this means that there won't be an opportunity to ask questions.
Good morning, everyone. I'm Mary Bartram. I'm the Policy Director with the Mental Health Commission of Canada, and I'm pleased to talk to you today just to provide an update about the Mental Health Commission's 5-year, $10 million mental health and cannabis research initiative. Before I start, I just wanted to acknowledge that the Mental Health Commission of Canada operates primarily on the unceded traditional territory of the Anishinaabe Algonquin Nation, whose presence here in the Ottawa River watershed reaches back to time immemorial. I'd also like to acknowledge the traditional lands across what is known as Canada, on which all of you reside, and our staff and stakeholders as well. So this morning, I just wanted to provide you a bit of a recap of how did we set the research agenda for this initiative, an update on the now 40 projects that are fully funded and underway, and results are starting to come in, so I'll give you a few highlights. Some of our other knowledge mobilization activities that we've undertaken, and next step. So in terms of the recap of how we set the research agenda, you may recall that at the beginning of this initiative, we worked with a team of researchers from the University of Calgary to undertake an environmental scan and scoping review to really identify where are the priority gaps for evidence and knowledge as it relates to the relationship between cannabis and mental health. So 4 highlights from that work. First, the need for research that draws on diverse methodologies. So in particular, the scoping work highlighted the need for qualitative research that amplifies the voices of people with lived and living experience and really helps to understand, people's experience of that relationship between cannabis and mental health. Secondly, more clarity on that relationship. Not just looking at the harms, although of course that's a very important part of the research agenda, but also open to looking and considering the benefits as well. Exploring specific modes of consumption was another highlight. So not just research on inhalation of cannabis and its impact on mental health, but also ingestion, and in the case of lab-based research with rodents, from injection to applicability with a human population. And lastly, the really key importance of research on cannabis and mental health among priority populations from a social determinants of health and equity lens. So as you'll see, these guiding principles really did inform the research. So of our investments, as I mentioned, we now have 40 projects underway, and for a total investment of $7.2 million, with 20 Catalyst research grants, 1-year projects, 4 team-based research grants that are a bit longer, 2 policy grants that are looking at policy issues, and this was done in partnership with CCSA, and then 14 community-based research grants, 2 years, $1.4 million in total. And I would just mention as well that we did have several partners that came on with us to augment our research agenda. So just a couple of highlights from some of the projects. So Canapix is a really interesting project that's really working on picturing the lived experience of cannabis use and mental health from a 2S LGBTQIA+ perspective, and this is a project based in Quebec. We also funded the First Nations Information and Governance Center to examine the relationship between cannabis and mental wellness among First Nations. So that's another really exciting project. And Karma as well, here really looking at working with peer researchers to explore the lived experience of the relationship between cannabis and mental health. So I'm pretty sure all three of these are from our community-based research projects. If you've seen the webinar series that I'll mention earlier, you can catch some of the preliminary findings from these really exciting research projects. So in terms of knowledge mobilization, I'll just highlight a few of our activities. So we did conduct a webinar series in partnership with the Canadian Centre on Substance Use and Addiction. It was in two parts. The fall series really focused on policy and health impacts. There was a bit more emphasis in that series on some of the research undertaken through CCSA on the impacts of legalization. And then in the winter, we also co-hosted a session with a bit more emphasis on mental health and cannabis among priority populations. This was moderated by members of the Mental Health Commission of Canada's Youth Council, and there were three different panels, one focused on impacts and experiences among youth, the other, the Indigenous-led projects that we have underway, and the third panel looking at other priority populations. So really exciting work. I can't wait to see what the final results are from our project. We've also conducted several other knowledge mobilization activities, including a dialogue series called Amplifying Black Experiences in Cannabis and Mental Health Research. So this was really to address the gaps in research on cannabis and mental health within Black communities. We worked with Dr. Kwasi Owusu-Bempah to convene 3 different tables to discuss cannabis use in Black communities, lots of discussion of systemic racism and other structural issues within Canadian society that have formed a backdrop for the relationship between cannabis and mental health and some of the policy issues arising from that relationship, and also to develop a bit of a research agenda for future research on cannabis and mental health in Black communities. To mobilize the findings from the dialogue series, we also hosted an educational panel in April, moderated by Dr. Owusu-Bempah, with panelists representing policymakers, educators, researchers, people with lived and living experience, to take a deeper dive into the recommendations in the report. And this picture was developed in real time during the panel to really capture some of the key themes. This spring, we've been working with the Atlas Institute for Veterans and Families to plan a similar dialogue series, except this time focused on cannabis and mental health in the veterans community. So there will be actually 4 sessions this time around, and really trying to identify research priorities and priorities for knowledge mobilization. What are the key knowledge gaps with regard to mental health, cannabis, and substance use within veterans communities? So we will be releasing a public summary report at the end of that work, so stay tuned for that. We were also extremely pleased in April, the Youth Cannabis and Mental Health course was released by the Schizophrenia Society's Cannabis and Psychosis Project and Youth Rex, with support from the Mental Health Commission of Canada. They developed a for youth, by youth cannabis and mental health course, which is just fantastic, completely designed by and led by youth, includes 4 modules providing evidence-based information. It's really interactive and very much accessible and interesting and engaging for youth. And then there's also a mentor guide for educators, peer support and youth workers, parents, and youth allies. So highly recommend that as well. So in terms of what's next, we are really looking forward to mobilizing the knowledge from the 40 research projects as it continues to come in. Of course, there have been delays during the pandemic, and we're working in lockstep with the projects to stay up to date on when those findings are going to be available for knowledge mobilization. We anticipate that the research that we funded will strengthen the evidence base on interventions for the treatment and management of cannabis use disorder. It'll enhance stigma reduction initiatives. It will build and strengthen our knowledge on the relationship between youth cannabis use and mental health outcomes. We have projects that will be strengthening the evidence base on cannabis use for everything from insomnia and concussions to PTSD, psychosis, and autism disorder. We have projects as well, as I mentioned, that are really going to help to inform how not just mental illness, but also mental health influences and is influenced by cannabis use across diverse priority populations. Over the coming year, we anticipate being able to mobilize new evidence from the 40 research projects through reports and summaries, further webinars. We have videos that are being developed to feature the findings from the community-based research projects, and of course we'll be at conferences and presentations and look forward to coming back here next year to tell you more about the findings. We look forward to releasing a really great video on the importance of community-based research on cannabis and mental health in diverse populations sometime before the summer, I hope. So something to keep an eye out for as well.
Right. Well, a lot of activity going on at the Mental Health Commission of Canada with 40 research projects. They may have their own session at our conference next year if all of that comes about in time.